Good day, everyone. You're all welcome back to my channel once again. This is time with Miss Joycelyn. I'm sorry for being away for too long. And today I would like to talk about something simple but extremely important. That is oral hygiene beyond just brushing your teeth. Many people think that brushing alone is enough. But despite brushing daily, some still suffer from halitosis, which is bad breath, and recurring throat infections like tonsillitis. Let's now delve deep into why using tongue scrapers and dental floss are essential for preventing halitosis and tonsillitis. Stay tuned and watch to the end. Like I said earlier, many people brush their teeth daily but still have recurring throat infections like tonsillitis and bad breath. So the question here is, what are we missing? And the answer is often two simple tools: dental floss and tongue scrapers. Let's start by understanding the problems. Now, what is halitosis? This is persistent bad breath that does not go away even after brushing. It is usually caused by bacteria in the mouth that produce foul-smelling gases. Common causes include food particles trapped between teeth, gum disease, dry mouth, poor oral hygiene, or bacteria on the tongue. Tonsillitis is also an inflammation or infection of the tonsils that are located at the back of the throat, often caused by bacterial or viral infections, food particles, or bacteria trapped in the throat area, or poor oral hygiene that allows bacteria to multiply in the area. When the mouth is poorly cleaned, bacteria don't stay in one place. They travel from the teeth to the gums, to the tongue, and even the throat area. So oral hygiene is not just about the teeth, it's about the entire mouth and the throat area as well. Many people ignore the tongue while brushing, but the truth is that the tongue is one of the biggest sources of bad breath. The surface of the tongue contains tiny grooves where food particles get stuck, dead cells accumulate, and bacteria grow and multiply. This forms a white coating or a yellow coating on the tongue called biofilm. This biofilm also produces sulfur compounds that smell very bad, and this in turn causes halitosis. Let's now talk about why brushing alone is not enough. A toothbrush only cleans teeth surfaces. It does not effectively remove bacteria deep on the tongue, and this is where tongue scraper becomes important. A tongue scraper, like the one I'm holding, is just a simple tool that is used to gently remove coating from the tongue. It reduces bad breath immediately by removing bacteria and debris to reduce the source of odor. It improves taste sensation, reduces risk of tonsillitis triggers, and prevents bacterial spread to the throat. Let's talk about how to use the tongue scraper. This is it. You finish brushing your teeth with a toothbrush and then you stick your tongue out like this. You make sure you scrape from back to front like this in strokes, and you wash the scraper. You rinse it actually after each stroke. So like this, then you wash it. You go again, then you wash it. Do this once or twice daily, preferably in the morning. There should be no pain and no force. Now, this is a pack of dental floss picks. Let's talk about the importance of using it. Even if your teeth look clean, there are still tiny spaces between them where food particles get stuck, plaque build up, and bacteria grow and multiply silently. And your toothbrush cannot reach these spaces properly. And this is why flossing is important. It removes hidden food particles, prevents gum disease, reduces bacterial load in the mouth, and supports tonsil health indirectly. This is so because when bacteria from the teeth and gums reduce, the throat area is also less exposed to infection-causing organisms. Now, let's also take a look at how to use the dental floss. So you take a clean one like this. The food particles that are visible, you can go this way with a pointed part of it and remove them like this. With the invisible ones, you turn to this side, the side that looks like a C shape. You curve it in a C shape around each tooth like this and remove the food particles from there. You move it up and down carefully like this. You do not force it or snap it into gums. Flossing once daily is enough for most people. Now let's connect everything clearly. Tongue scraping removes bacteria from the tongue, and then flossing removes bacteria between teeth. And together they reduce overall bacterial load in the mouth. When bacteria reduce, bad breath reduces significantly, and inflammation in the mouth reduces as well. Bacteria are less likely to reach the tonsils. Risk of tonsillitis also decreases. So, instead of only treating infections after they happen, we are rather preventing them at the source. Here is a simple oral care routine anyone can follow. In the morning, you brush teeth, you scrape tongue, and then you rinse mouth. In the evening, you brush teeth, you floss between teeth, and you rinse mouth. Remember, consistency is key. Doing this daily is far more powerful than occasional deep cleaning. In conclusion, good oral hygiene is not complete with brushing alone. Tongue scrapers and dental floss picks are simple tools, but they make a big difference. You can get tongue scrapers and dental floss picks from any pharmacy around you, or send me a DM to get yours because I have them in stock. Each tongue scraper costs 10 Ghana cedis, and then dental floss costs 22 cedis for a 50 pieces pack. Fresh breath and cleaner teeth don't have to be expensive. Get yours today, and I'll see you in my next video.
Thanks for watching. Keep supporting me.